Dr. Michael Osterholm is the director of CIDRAP. We can all say that word, can't we? Because we've been hearing it for a while. The Center for Infectious Disease Research and Policy at the University of Minnesota. We know that decisions during a time of pandemic weigh heavily on all kinds of leaders, including religious leaders. I think we in the church have felt the heaviness of these decisions, especially about in-person worship. What an incredible gift to have Dr. Osterholm with us to provide insight for the decisions we as church leaders need to make. First, with us last May at a gathering of rostered leaders, and now again today. An authority respected around the world, his home is in Minnesota. He's held positions in the CDC, the U.S. Department of State. He served as Minnesota State epidemiologist, and most recently, he served on President Biden's coronavirus advisory board. He's the author of Deadliest Enemy, Our War Against Killer Germs, and is host of the very popular CIDRAP weekly podcast. As a member of Edina Community Lutheran Church and a regent, as well as graduate at Luther College, he knows about how Lutherans love to talk about vocation, and we often talk using the words of Buechner, the place God calls you to is the place where your deep gladness and the world's deep need meet. This year we have seen a whole world in need. We are grateful, Dr. Osterholm, that God has called and prepared you and gifted you to help us meet the need of our world. As you listen to his presentation today, please feel free to write questions in your chat. We will have time to respond to them after the presentation. Please join with me in welcoming Dr. Michael Osterholm.
Well, thank you very much for having me this morning. It's good to be back with you, and I appreciate this opportunity. I think that there have really been two houses of healing through this pandemic, those in our medical care system and those in our churches for our souls. The challenge with the churches is we couldn't be there, so we had to find creative ways to create the same houses at some distance, and I applaud much of the work that you all did to reach out and to provide that type of support during this very, very long, very difficult time period. Well, let me start out in a sense, the way I almost started out this presentation to you some time ago, and that is a disclosure. And the disclosure is the more I know, I think the less I know. And so that from that standpoint, I'll tell you exactly what it is we know and don't know today, and where we still have many challenges before us to try to understand what this pandemic is all about. Let me begin at the global level, as we are all God's children, and share with you what's happening outside the United States, and I'll come back and focus on the United States and specifically Minnesota. Right now, we are absolutely in the darkest days of the pandemic, something that I feared greatly would happen and has happened. This past week, the most number of cases reported to the World Health Organization for any one given week occurred. The numbers are escalating quickly, as you've seen situations in places like India, but we're seeing outbreaks throughout the world within a country that have been substantial and have resulted in just horrific scenarios. Right now, we know we are not counting deaths in India by the hundreds and hundreds and hundreds because of so many occurring. And so this virus is continuing to do what it's going to do around the world. In the areas that have had vaccine, which right now is a very limited number of areas of any substantial amount of vaccine, about 90+% of the vaccine has been available in only 10 different countries. Much of the low and middle income countries have been without vaccine. And the one program that we've had to try to enhance getting vaccine to low and middle income countries, a program called COVAX, which was launched through the World Health Organization, has stumbled badly in the sense that India was supposed to be one of the primary suppliers of vaccine to that program. But because of the situation in India, the country has now prohibited any vaccine made by the Serum Institute of India from being exported outside of India. So this I'll come back to because this has real implications for us, not just humanitarian, but also just how secure are our vaccines going into the future. In terms of what's happening here in the United States, let me just say that I think it's clearly been a major win in many ways with the vaccine program. I give great credit to this administration's efforts to not only secure more vaccine, but to distribute the vaccine. The challenge is we've hit a peak. We knew this was coming. I talked about this way back in December that we had two challenges, the last mile and the last inch. The last mile was getting vaccine to our local areas so that it could be distributed. The last inch is getting people to actually take the vaccine. And today, around the country, we see a variety of different experiences by any number of categories: race, ethnicity, socioeconomic status, political beliefs, age. It's a sundry of things. But in many instances, we only have in the high 20s or low 30% of the population in any one given state that have been vaccinated and successfully protected against this virus moving forward. When I say successfully protected, we'll talk in a moment about those breakthrough cases, which are surely bound to happen. So where are we at right now? Well, in Minnesota, as you know, we actually are hopefully hitting a peak. We'll have to see over the course of the next 2 weeks of cases. But just yesterday, we reported over 2,100 new cases. Our ICUs right now have as many cases today as they did back in December. We're seeing substantially increased transmission of the virus in young children, and this has been a real challenge. Now, in terms of our vaccine programs, however, we've been very active in getting vaccine out. It varies in terms of location, where you live, your race, ethnicity, your age. But again, we have pockets here in Minnesota where we still are very under-vaccinated. Nationally, we have up to a fifth of those individuals 65 years of age and older who have not yet gotten vaccine. And so we're far from over with this. I use the example of Michigan. Michigan is a state not far from here, one that we have obviously paid very close attention to, and they have gone through the very worst of the pandemic over the course of the last 4 to 5 weeks, as they have at any time since the pandemic began. Their vaccination rates are only slightly below ours, but they're better than 22 other states. And the possibility that we're going to see more Michigans develop throughout the country is very real. Meaning that, in fact, what they've seen there is a real challenge. Just yesterday, they had 70 children hospitalized in Michigan who were seriously ill with this, something we hadn't seen before in this pandemic. Well, why is this happening? Well, there's really been a game-changing event that's occurred back in November. I'm often asked, what inning are we in with this game? And I have had a new answer since November and said, we're about the second minute of the first quarter. And they said, what? That's not baseball. And I said, the variants are game changers. Variants, a word that is so important to us right now. What is a variant? Well, ever since the very first moments that this virus emerged, we have seen it mutate. The fact that when it reproduces itself, it has many challenges in doing it exactly the same way over and over again. Most of these mutations, which then result in what we call a variant, have been of no consequence at all from a human health standpoint, other than like a red car versus a blue car versus a green car. In November, we recognized, whoa, wait a minute, there are some significant issues here. Some of these mutations have changed the way the virus interacts with us as humans. First of all, there are 3 different categories now of variants that we're concerned about. One that makes the virus much more infectious. 2, one that makes it so it causes more severe illness. And 3, one so that it may evade the immune protection of either the vaccine or previous natural infection. And what we're seeing right now is the fact that there's a variety of variants around the world and new ones emerging every day. If we look at, when I talk about why it's so important to address this issue of infections around the world, yes, it's a humanitarian issue. Yes, it's a challenge. But it is all about the security of our vaccines. If we see more and more of the mutations result in variants that may evade immune protection or that from either vaccine or from natural infection, then that really threatens the very security of our vaccines. Now, to date, the data would support that there has been impact with these new variants. It doesn't mean that the vaccines or previous infection have no protection. In fact, they may still offer substantial protection against serious disease and hospitalizations. But at this point, this is still wide open. We don't know. And as we see more and more transmission around the world, and I don't see that stopping at any time soon, the more variants are going to basically spin out of those environments and ultimately end up in places like the United States. So this is a challenge. The variant that's confronting us right now here in the United States primarily, and surely here in Minnesota, is one we call B117. This variant emerged in the United Kingdom back in November. This one actually is a virus that is much more transmissible, anywhere from 50 to 100% more transmissible than the previous strains we dealt with last time we talked, as well as causing much more severe illness. And this is one that has fundamentally changed the game with children, where today we are seeing much more transmission in children than we had previously, and much more severe illness in these children who get infected with B117. You've heard about the outbreaks we've had here in school-based activities, athletics, and so forth. And just to give you an example, just a little over a week ago, in the two previous weeks before that time, we'd had about 790 schools in Minnesota that had actually had cases of B117 in the schools. That was not that dissimilar from the number we saw in the peak activity last November when we were at our very worst. The difference is, and this is very important, is back then less than 20% of the schools had multiple cases or opportunities for what we'd call outbreaks to happen. Right now, over 80% of the schools do. So once this gets into kids and into the community, it surely transmits much more readily, and we're seeing that. The other thing we're seeing is with the increased vaccination in the older age population, 65 years of age and older, and I was so glad to see the summary results of the people on this program this morning. Congratulations to the almost 80% of you who are vaccinated. The challenge we've had is with the older population, we're still going to see cases because we surely don't have them all vaccinated, and we're seeing some breakthrough cases. Remember, a vaccine that is 90 to 95% effective, if you vaccinate millions and millions of people and you still actually have virus in your community, you're going to see people who are not fully protected. This is accentuated in the older age population, people who were not included in the original trials to look at the effectiveness of these vaccines. We know from influenza vaccine, for example, you can have a vaccine that will protect 50 or 60% of young healthy adults, and almost zero in terms of older aged individuals, particularly the frail elderly. So we're expecting to still see cases occur in the older age population, even among those who have been previously vaccinated. But what's striking right now is the actual incidence, not proportion of cases, because if you pop a balloon in one place, it pops out somewhere else, doesn't mean you have more air in the balloon. What we're talking about is if you cut down the number of cases in older aged individuals, you may say, well, proportionally, there's a lot more cases in younger people. Well, that's true. Doesn't mean there's more of them. Well, what we're seeing is actually more in the 20, 30, 40, and 50-year-old age groups right now who are requiring hospitalization and even ICU care. Falling in place with this B117 that we talked about that is actually not only more infectious, but causes more severe illness. Now, the good news is that the vaccines are working well against this B117 strain. The ones that have been a challenge to us in terms of basically evading the immune response have not been prominent at all in the United States in any meaningful way, and at this point, we'll have to continue to follow that. Now, where do we go from here? There are many questions, and we're all searching for the answers. I worry that in some cases we're requiring perfection to be the ultimate goal when good is really what we need. For example, I'd be happy to answer practical questions today, but you know what? I've been outside for a long time without a mask on of any kind. I'm vaccinated. The evidence we have right now for transmission in outdoor settings, if I'm walking in a park with my partner, there's the risk of that is so small. I think I probably have a greater risk of being killed in an automobile accident driving to the park than I do transmission walking in that park. People are fearful of that. We need to understand that. I worry very much, though, about indoor air yet. We are still seeing outbreaks where we have people who are not adequately vaccinated coming together and in events where, in fact, we'll see this transmission. So we're kind of balancing back and forth. What do those situations mean? As I said to you a year ago, and at that time, I know people challenged the notion, I called it at that time hygiene theater. We were impressing on people the absolute risk of any kind of surface being contaminated would ultimately result in transmission to you. And that was just plain wrong. We scared the hell out of people needlessly for that reason. And finally, CDC just 2 weeks ago came forward and said, you know what? We don't have any evidence that shows that the contamination of surfaces plays a role in the transmission. So wiping down all your groceries or doing all those kinds of things like that are totally needless. So that has surely been an important point. Another area is just respiratory protection. I just want to be very clear with you. And I know that this is not always the best answer you want to hear. But when you actually look at respiratory protection against someone in, for example, an indoor environment, there's different types of devices that can be used beyond addressing the overall environmental aspects of your HVAC systems. The one that is the basic foundational protection is the N95 respirator. And I call that a respirator. We don't call those masks. Those are the very tight face-fitting devices that you can buy that actually have a type of filter that allows air to pass through it so that you can breathe more easily in holes that are big enough for the virus to jump right through. But it has an electrostatic charge, so it traps the viruses so that basically you don't sit there and try to suck through cellophane all day, and at the same time, you're still protected with the virus. Our studies and others have shown about 1% of these very small particles can escape in and out. And remember, the fit is very important. It is like a swim goggle. The goggles don't leak in the glass, they leak in the tightness around the face. And that's why these are so important. If you go to surgical masks or a medical device, medical masks as they're called, you can get up to 40 to 50% leakage in or out. And now I still tell you to wear those if that's what you have, because you get some protection. But remember, it's about time and it's about dose. So if you have an environment that has lots of virus in it, somebody's in a small room infected, you will reduce the amount of time that it will, you extend the amount of time it'll take to get infected. But if you're spending several hours in there, it may not make any difference. You're not fully protected. That goes even further when you get into cloth face coverings, where we now know 50 to 60% to 70% leakage occurs in either in or out. And gaiters, it's even higher. And I just tell you this because I don't want to tell people indoors not to wear something if you don't have an N95 respirator. But remember, it's time and distance. If you're in a room and you can smell someone smoking a cigarette, or if you're in an outdoor area where you're then close to someone over time and smell that cigarette, that's the same as an aerosol. That's the way this virus is transmitted. So I still come back to the issue of respiratory protection, and I just want to reemphasize that's important. Now, if you're vaccinated, that isn't the issue. At this point, I have said over and over and over again, I hope more and more individuals find their like partners or like friends. They get together, everyone vaccinated. They have one absolutely incredible party, lots of hugging and kissing, up close, and basically feel safe about that. So when I talk about respiratory protection, I'm talking about being in an unprotected area with unprotected people who are not vaccinated. Now, and you can't cheat on that. I hear far too many situations where people say, well, most of the people are vaccinated. Well, that's like saying, you're only fixing 2 of the 5 screen doors in your submarine. That doesn't work. It's got to be of those who are basically fully protected or not, knowing that there will still be some breakthrough activity, but when everyone comes together vaccinated, that makes a big difference. I know this will weigh heavy on the minds of church goers. Next is, how do you know if someone's protected? And this has been a challenge, and I've been involved with this issue, the discussion of what we call immune passports. This concept of somehow having a record of, was I vaccinated adequately, or did I have previous infection, and have evidence of that can confirm that I'm likely protected. And this is going to be a controversial area. Some places, such as Texas and Florida, have already said they're going to ban it, where others, for example, in New York, the Empire program of California, they're actually requiring it in many venues. I can tell you I'm dealing right now with a number of public venues, performance locations, et cetera, where I think in the near term it's going to be required. And people say, well, it can't be done. You got to worry about confidentiality. Well, I'm one of those people who gave up my eyeballs and gave up my fingerprints to a private company so I could get in and out of an airplane faster. And so I think you're going to see people who are going to want to know, basically, do I have to get the vaccine? Well, no, but then you might not be included in certain activities if you want to feel comfortable in providing people protection. And remember, we don't just vaccinate for ourselves. We vaccinate for everyone. The more people we have vaccinated, the more likely we are going to stop any transmission in any kind of environment or setting. So I know I've laid out a lot of different issues here. I tried to touch on a few. I didn't have an opportunity to go into any of them in great depth. And I'm looking forward to the question and answer period. But again, I just want to come back and make it such an important statement that thank you to all of you for helping healing this past year. Again, it's not just about healing one's body, it's also healing one's soul. And this has been a real challenging year that way, one that I think all of us can fully agree we never want to go through again. So with that, I'm happy to turn it back over to you and answer whatever questions I can.
Thank you so much. And we do have a few questions, actually quite a few questions. I'm sure you're not surprised. Do you know anything further about how long vaccines are going to be effective? When will those who've been vaccinated need to be vaccinated once again?
Well, yes, absolutely great question here. We don't know. And let me just say that the studies that have been done to date show that at least up to 6 months, generally speaking, there was still very good protection from the vaccines that we got. Now, those are primarily the messenger RNA vaccines, the Moderna and Pfizer vaccines that we've looked at. There's other ones, part of what we call an adenovirus platform vaccines, which we can talk more about with J&J and AstraZeneca. But there really are two issues around the vaccines and protection. One is, how long does just my immunity last? Meaning that, if nothing else changes, it just wanes and gets weaker and weaker and weaker, and one day it's just not strong enough. That's when you get a booster dose. That's when it's the same vaccine I got before, but now it's been to kind of rev up the old system. There's a second kind of vaccine that we're talking about right now, which would be more akin to what happens with influenza vaccines. We change the strains from year to year because the virus changes. And some of the discussion we've heard recently is all about the fact that with these new variants, we may actually be giving a quote-unquote booster dose, as has been stated, but it really is a new vaccine that's trying to specifically attack the mutations that are limiting the effectiveness of that vaccine. And so both of those are in play. And it's unclear either one how we're going to do that. Now, you've heard the two companies, Moderna and Pfizer, both note that they're working on those new vaccines, and that the CEO of one of the companies actually said it's likely that in 6 to 12 months we'll be doing booster doses without any clarity of what that really meant. So it's a stay tuned moment right now. I wish I could give you more clarity on that. I worry about it a great deal because anything that compromises international vaccine availability, which is all about manufacturing and what's available, if we're suddenly now going back to these high-income countries and going another dose for people, that's just that much more vaccine that's not going to be available to low- and middle-income countries, which, if we don't take care of, it's not just a humanitarian issue, which it is that, but it's also then we're going to see these variants develop more and more every day. And, we just don't have any idea yet what the kaleidoscope of variant production is going to be with widespread transmission around the world. So stay tuned.
Talked about gatherings where those who have been vaccinated could meet together and not need to wear masks. Now you're also talking about the increase in children becoming infected, and children aren't eligible yet for vaccines. So when we think about those kinds of gatherings, whether it's a family gathering or a church worship service, how does that all work together?
With great difficulty. It's a situation right now where I anticipate, potentially as young as 10 years of age, we will have vaccine approvals sometime this summer, and hopefully sooner than later. There are already studies being done, we call de-escalation studies, where we take the age slightly lower each time we study it, just from a safety standpoint, down to 6 months of age. And if I had to give you my best guesstimate, I think probably by the fall, and maybe mid-fall, we will have vaccines approved 6 months of age and older.
Wow.
And at that point, I think that's going to be the game changer issue, getting our
Right.
kids vaccinated. And then I think, we're back to, the way, much more like the old days. But until then, it's going to be somewhat of a difficult situation, mixing and matching. Now, we don't have any magic wand here, no pixie dust that can tell us exactly what to do. You've already seen confusion created when the CDC said, well, if you're vaccinated and you're only having contact with one household with your grandkids, and you can go and have contact with your grandkids. People say, wait a minute now, you said kids are a problem, and now you're saying to go have contact with them. And, this is part of the confusion right now. There just aren't any good answers. CDC said a couple of weeks ago, okay, if you're vaccinated, you can go fly now, but don't fly right now, okay? Because of all the virus that's out there. And people said, wait a minute, that doesn't make sense either. And so I try to explain that one more from the standpoint, imagine I'm a firefighter and I have now been given this incredible fire protection suit that's 90 to 95% effective. What a great gift that is. But would I still walk into a 10-foot high wall of flames with my 90 to 95% effective protection suit? No, I'd still try to avoid that 10-foot wall of flames. And so that's what the vaccines are like right now. You know what? You could not get me to go into a public restaurant right now and eat. I won't. I still have challenges going to fly on a plane. Personally, I'm telling you that I was last on a plane March 10th of a year ago. And I fly 150,000 air miles a year, and I haven't been on a plane since. Not just about the plane, but all of the environment that I'm in that setting. Now that's going to have to change. That will change over time as we get more people vaccinated, if we are successful in getting more people vaccinated. But for right now, I think this is what we're trying to navigate. How do you live life practically? You can't just be a bubble. But at the same time, how do you do it wisely? No one wants to be the person that gets COVID and dies 3 days before their scheduled COVID shot, or having gotten their vaccine and still having developed severe illness because they threw caution to the wind and kind of went anywhere they could that was, potentially a high risk for transmission. So I think the kid issue is just a tough one. As a grandfather of 5 grandkids who I love desperately, we all struggle. And right now, we know we have lots of transmission in our schools, and that's a big challenge.
So you would probably suggest to leaders of these congregations that even if, all of their adults were vaccinated, having in-person worship that welcomes, all these wonderful children who we thought we wouldn't catch it from is problematic?
Well, let me put it personally. I wouldn't come to church. Okay? And I think you just have to understand, that's the risk that even though I'm double vaccinated right now, we know that the school kids are posing a substantial risk. And the more you get together, the greater the likelihood. Now, that may pass. We may see the incidence in kids drop over the next weeks ahead and can say, the risk level has really dropped precipitously. But right now, we've had more kids diagnosed with COVID-19 in Minnesota in the last 3 weeks than we've had in months combined.
Oh.
It's right now. So, that's the challenge we're running into is this very moment.
And that actually was one of our questions. Would you be willing to share personally when you might be willing to come back to in-person worship?
Well, I wish it were yesterday. I still wish it were. And I think, when we have the congregations that are willing to be vaccinated and protected, I think that should be part of it. Now, people will say, you can't make me get vaccinated. But if there was ever a Christian spirit, love thy neighbor, basically you would do that to protect your neighbor. If you don't even believe yourself, it's okay, it's right. I don't want to get it. Then that's a challenge. And there are very, very, very few people, by the way, who can't get this vaccine for safety reasons. Very few.
Yep.
And the other part I would say about that is that from the standpoint of protecting others with these vaccines right now, there are challenges that we're still working on. For example, the immunocompromised. If you've been an organ recipient, if you've had certain blood cancers, etc., there are some real challenges of knowing just how protected you are. So for those who may be the least of our protected, even though they've done everything to try to protect themselves, they've gotten vaccinated, they've done all that, we still have to worry about those. And we're still trying to learn what it's like for immune-compromised people to be in public settings with these vaccines. And this is not a satisfactory statement for those who are immune-compromised. I'm sorry, I wish we had more data. But that's a challenge. I don't want to put someone who in good faith at 67 years of age has been vaccinated but has an underlying health problem by putting them at risk by coming to church. And we've seen far too many church service-related outbreaks. I can tell you with certainty, funerals, weddings, special occasions, etc., where everybody thought it was going to be okay, and it wasn't. It wasn't. And so I think that that's what we want to avoid. And in Minnesota right here, we have a whole number of funeral, weddings, combination church services that were held, even though most regular services were not, where we had substantial transmission and subsequently people died.
What about singing? If a group is worshiping outdoors, can they all sing the hymns?
Yeah, I think, again, outdoor is really a much safer environment with distancing. And now if you're, all stacked up, like a choir shoulder to shoulder, then I think outdoors still poses some risk just because of the close proximity. But as we discussed a year ago, even with singing in distant locations, meaning 10 feet apart, the air will dissipate that virus quite quickly, and I feel very comfortable that that kind of singing is just fine.
And indoors? Any thoughts?
Indoors, it's still a real challenge. We've seen far too many. I mean, the classic outbreak is the one that was held, in the Seattle area that everybody knows about, where people were still distanced physically. In some cases, were many feet apart from the one individual who was infected, and yet the attack rates were exceedingly high in that one choir practice event, one practice event, and we've seen that elsewhere. So, singing is a wonderful way to communicate, but it also is a wonderful way to spread viruses in the respiratory tract.
One of our key ministries in the summer, Bible camps, summer youth camps, gatherings that church sponsor, like a week-long summer camp, outdoor camp. Any concerns about hosting those?
Yes, but I think on the other hand, we can respond to them. For example, a number of camps have actually engaged in routine testing of the participants. So they have to be tested before they come, and then they do the rapid screening tests on them, every day or every other day during camp. That way they can be assured that if they're picking up somebody early with infection, they don't stay and remain in that camp in an environment that then causes widespread transmission. And I think there's an example where you manage the risk with that. So I wouldn't say don't hold them. I would say, what is your plan to make certain you don't have transmission within those groups?
Question around testing, and it simply says, can you address the confusion around testing?
Well, let me just say that's a wide open question, so I'm not sure what the confusion is.
Okay.
I'm
not either.
What?
I wasn't either. That's just the question handed to me.
Let me just say, I think if it's confusion as it relates to how effective the tests are, these PCR, nasal swabs, saliva tests are actually quite good, very good. The tests you buy right now at the drugstore, et cetera, are likely much less effective in picking up infections when you actually have them. Some of the tests are not very good at all. I've served, actually, I still am on the NFL testing committee. It's a group that's basically worked closely with the NFL, keeping them open during last fall season in a way that people said could never happen. But that was an unusual situation where testing was done every day on individuals and different kinds of tests. And we found often the testing picked up people in their earliest stage of infection before they had any clinical signs or symptoms, even if they did at all. And so again, getting people tested with an effective test early can be a real way to reduce transmission. Now, some of our tests didn't pick up the infection until basically the people were quite sick. Well, those aren't going to be very effective tests if, in fact, you're trying to limit transmission. So again, if you are ill or you've been exposed and you have questions, I would still urge you get one of the PCR nasal or saliva tests, and they are very effective.
Good. You talked about being outdoors and not masking. Is that something you would suggest for all persons or for only persons who are doubly vaccinated?
You know, at this point, I do it for all people. I mean, the vaccination surely is that fireproof suit. But I think that if you keep distance from people out walking outside, I mean, right now, I mean, as we all know, there is the light and the light, okay? And the light of summer is such a gift. Don't miss it. Don't miss it. For people who just need to get out for their mental health reasons, get out. But that means don't stand in large crowds. Don't congregate and talk to people. One of the things I've heard someone contacted me about and said, I love to take my mother out for a walk, but every time she meets somebody she knows, we have to sit there nose to nose and talk to them for 10 minutes,
Right.
you know? And I understand why. I mean, that's part of the mental health aspect of the walk, but I think that's what you also want to do is make certain that, you know, you keep your distance apart from people, you know, 6, 8 feet,
Right.
moving, and I think you're just fine. And, you know, I again, you're going to see people coming up with these recommendations or requirements that are seemingly based on lots of science, and they're not. They're not. I mean, we have to just be honest and say, when do we know what the hell we're talking about and when don't we? And, you know, this whole issue of outdoor air, et cetera, is more, it's not gestalt. It surely has science behind it. But for me to say, you have to be this far apart for this long or this distance, I can't say that. But I can say if you're out walking around an outdoor park, you're walking and you're not in crowded locations, you're not in crowded elevators, you're not, you know what, do it. Yeah, the likelihood of infection from that is so small.
That said, it makes me think, I was at an outdoor worship service last week where everyone was masked, and it made me think of, I think one of your things that you said in May was that the predictability of the environment is really critical, like the grandma going right up to the person she wanted to visit. And I think perhaps we might want to suggest we do wear masks when we gather for worship outdoors. Do you have a thought about that? Just because
well,
in some
again,
ways...
as I stated earlier, remember, masks have a variety of different levels of protection. From the N95, which is very effective, it's fitted tight to your face, to cloth face coverings, which still have 50 or more % leakage in and out. Now that is helpful. Just think of it this way. When I'm in an accident, you know, if I tell you to wear your seatbelt, I surely hope you do, and it has a difference. But that what saves you in that accident is the airbags, the seatbelt, the crushable body, the shattering glass as opposed to the shards, all the different things that go into making that accident less likely to cause severe injury to you. Well, a face mask, as we just discussed, one that's cloth face coverings, basically will reduce the likelihood of you getting exposed. But if you spend enough time at a high enough dose, then you know basically that you're still putting yourself at increased risk. And so if I cut down my infection rate by 50%, meaning what comes in and out, but I spend 3 times as much time there, I still have a higher dose than if I wore nothing and was only there for a very short period of time. So again, I come back to kind of that cigarette example. You can smell a cigarette through your mask, then you know you basically have one that's leaking. And if it's leaking, it will give you some protection for some period, but it's all about dose and time. Outdoors will surely decrease that because of the dissipation. Now think about that. If I'm in a room, in your offices where you are right now, somebody's smoking, you're going to smell it. If I'm out in a parking lot and I'm 30 feet away from somebody who's smoking, I might not smell it. That's exactly what you're doing. So if you want to wear a mask, you know, so be it. It will provide some reduction, but in the end, it's going to be the distancing and the amount of time that you're with somebody who might be potentially infected.
A question specific, very specific. A person had a very severe case of COVID and now fears that getting a vaccine may cause them to regress. What do you say?
Just the opposite. Very legitimate point, very legitimate point. And so I take the questioner's point. But we actually know that the vaccine provides a more superior protection than disease itself. It actually activates part of the immune systems that we believe actually are enhanced. So we actually recommend people who have been infected still get vaccinated. typically we'll say 90 days after the infection to get vaccinated again. And some would say one dose is enough. Others will say that, well, you better get all both doses, so if a question ever comes up, are you really protected? Talking about these immune passports, you are. So definitely get vaccinated again, or for the first time if you've actually had COVID.
The ELCA, the 65 synods, are partnered with 65 churches around the globe. We're partnered with Nigeria. And I'm just curious whether we could do anything to help this global access to vaccines in partnership with our what we call global companions. This seems to be a really very significant concern, both just for humanitarian reasons, but also for the spread of this virus and its mutations.
You know, I wish I could tell you could. I think the most important thing you can do is keep getting the message out to our elected officials, leaders, why it's so important to get vaccines to the rest of the world. But the vaccines are not going to be an open market issue. They're going to already be decided by these government agencies and philanthropic organizations that are providing the support for that, and then finally the vaccine manufacturers. So COVAX, which is the program that I mentioned before, basically trying to get vaccines to low and middle income countries, already basically is dealing with it. Our problem is this is not the idea of purchasing on the open market vaccine. There is just a very, very limited amount of production relative to the world needs right now. And so you couldn't buy it if you had all the money in the world. You couldn't influence it necessarily if you had all the royalty of the world on your side. It's about access to a very limited product, which is really unfortunate. Yeah.
This question is from a healthcare provider receiving seriously ill patients from rural Minnesota, and the numbers are increasing. And this person asks, how do we as a church amplify the message of vaccination, mask use as an act of care, love for the neighbor, especially to those places where people are skeptical?
Well, I have to say the questioner said it better than I could say it. I mean, you've stated the case, and I think that that's what it's really all about, is helping people to deal with that. I had a conversation some months back with a world-famous historian of the U.S. Civil War, and in our discussion, he said to me, for the first time in my career, I really now understand what it must have been like for a father and a mother to see half of their sons go fight for the North and half for the South. And, we have seen such division over this issue of COVID and what it means and doesn't mean, and denial, people who have denied it. I had an internist explain to me once that probably one of the most challenging moments in his career, and this is an individual who had actually been in the military in Afghanistan and Iraq, and he said was, he was with an older gentleman who was dying in the ICU from COVID. And he had one last wish with the ICU doc. And he said, please don't tell anybody or let anybody know I had COVID. Tell them I had something else. Now, imagine on your last dying breaths, that was that important to you that you wanted to make sure nobody thought you had COVID. Not about your family, not about, what does this mean to me? So the angst is real. It's there. And, we're still trying to understand it. Recent surveys suggest that up to 40% of men in the Republican Party across the board refuse to take the vaccine. And, that's an example of where shouldn't be about party, it shouldn't be about race or gender, it shouldn't be about socioeconomic status. It should be about this virus, and yet there is such mistrust and distrust. I have to say, in my own world, I've been in this business for 46 years. I've dealt with some pretty tough topics. We were the group that made HIV reportable for the first time in the world. The state of Minnesota did. And at that time, gay men had every reason to be concerned about what that might mean for them in terms of the kinds of social, political implications of, they thought, oh my God, the government has my name now. And, I can tell you, having been through all those things, nothing prepared me for COVID. It's not unusual, it's routine for me to get death threats. It's not unusual for me to get emails or phone calls that would burn your ears in the first 30 seconds of getting it. And, I'm just a messenger. I'm not the virus, but at the same time, it's people reacting to what's happening. And I understand the challenge. It's not just a physical challenge. It's an economic challenge. It is socially, politically difficult. But I think that what's happened is the amount of angst that is in the society today is real. So the questioner's point is right on mark. How do we help people understand that they don't want to get this? And I just have to go one step further and just say this past week was a classic example. Ted Nugent, who many of you may know, the rock star, who is very conservative, who has spoken out largely against the fact that COVID even exists and that it really is just all made up, was a recent case himself and was critically ill, very sick. He said, I thought I was going to die. And yet in all of his postings this week, he said, don't get that vaccine. Do not get it. Do not get the vaccine. You don't need it. I mean, here's a guy who went through it. And so I think that we can just keep doing what we're trying to do. I just, in this light, let me just make one last comment about this healthcare worker. Thank you. Thank you for what you're doing. I can't emphasize enough how much the healthcare providers of this country, of the world, have sacrificed so much for themselves. And I just have to put a plug in. This is my own personal plug, but I helped start an organization this past summer called Frontline Families Fund. And it was basically to provide support to healthcare workers' families of healthcare workers who have died of COVID. Over 3,700 healthcare workers have died from COVID infection since the beginning of the pandemic. Now, not all of them acquired it at work, but many did. And many were not doctors that had, made big salaries, had life insurance policies. They were the nursing staff. They were the nursing assistants. They were the transportation people. They were the ward clerks. And many of them, single moms who left behind 2 and 3 kids with nothing at all. So we have this foundation to help support these families. And I can tell you the angst there of what healthcare workers have had to do. It's been tough to watch that. So thank you, all the healthcare workers on this event today. I just can't thank you enough for what you've done for us. Thank you.
It's probably a quick question. Does the vaccine protect against transmitting COVID to others?
The question is still open on that, but I think it to the point of where I'm not going to tell people to wear masks the rest of their lives. Now, I'm sure I will get a lot of feedback on this comment because I know these comments will go wide and far. But, at some point, we've got to move on with our lives and make tough choices. And this is one where if you're vaccinated, maybe, we already know we have breakthrough cases. They happen, and so you'll likely be infectious. But does that mean we're going to keep wearing masks or distance like that? I think if you've not been vaccinated and then you have a much higher likelihood of not only getting infected, but likely being infectious. We're still learning about how infectious somebody might be if, in fact, they've already been vaccinated or previously infected and get infected again. But I think at this point, there is no way we're going to see society live their life in the years to come in the way we've lived it in the last year. So we're going to have to find is that spot. 40,000 people last year died in this country from automobile accidents. Does that mean we don't get in cars anymore?
Right.
And so, somewhere we've got to come to that balance, but that doesn't allow us to take irrational risk. I think that's the challenge we're all trying to come up with is what is the acceptable risk? We're never going to get this to zero. Don't even think about it. But the point of it is what's reasonable and rational so we can move life on.
So you talked about being part of the NFL advisory committee. When might you imagine a person could watch in person the Gophers play volleyball or basketball?
This is where we can use your help. This is where I think the churches of our country, the religious leaders, it's when we get people vaccinated. It's when I don't have to worry that 40% of the people coming to that event are not going to be protected and may very well be infectious and sit next to me.
Right.
And, my vaccine's going to work pretty darn well, but it won't work all the time. It'll work almost all the time. If I'm immunocompromised, though, I'm a kidney recipient. We're still trying to figure out how protected you are. Now, should they not be allowed to go to those events because somebody else is saying, it's my right not to get vaccinated? I think we got a lot of questions to ask there. So please help us educate the public why vaccination is such an important piece of our response, and that it is about helping everyone. If there was ever a Christian thing to do, Jesus would have been one of our most prolific vaccinators. I'm certain of it. And the Virgin Mary would have been there to help out, and the apostles would have been all part of the ancillary staff. That's what we need right now, is we need to have us all really supporting vaccination.
When I go to Nigeria, which I haven't done for a couple of years now, of course, I have to carry my yellow fever vaccination card. I think it's free, yeah. And I've just thought, why is that such a big deal? I think partly because we call it a passport, and that's not what it is. But do you have thoughts about
No, I'm in the same boat. One of the last trips I took just before before the pandemic was to Ghana. And I had to go all the same things you do. I've been there. I've had to deal with drug-resistant malaria in one of the trips just before the pandemic in Southeast Asia. So I understand completely. I think the challenge is that people, first of all, we're concerned about people having documents used for nefarious purposes. Already we're seeing forged documents supporting being vaccinated. So people who don't want to be vaccinated but want to have the benefit of acting like they're vaccinated so they can get in and out of places is real. So I think this is an ongoing discussion. The administration has said they're not going to issue them, and I can understand to some degree why, but I hope that they provide more oversight along with other countries of the world, governments, how we can set up a system where information can be protected, where it can be kept current, and where it's accessible so that, if I want to go to a venue, I want to go to a concert somewhere, I basically, just like I show my driver's license or my passport or my yellow card, I get in. Like I said, I've already given up my eyeballs and my fingerprints to a private company just so I could get on and off a plane, quicker. And so I think that's the kind of thing we're going to have to make those choices about, and I hope that we are able to do that. What we can't do is allow it to be discriminatory, those that have and those that have nots. I get to do things because I have the privilege of having been vaccinated and having this card or whatever. You don't, so therefore you can't. And I think that's one where, the churches can help about, the issue of equality, the issues of access, and helping to make sure that we don't have people left behind that way.
You may have already covered this, but I have a comment from one of our participants. The smelling cigarette smoke analogy is so very helpful. Thank you. Part of the struggle for church leaders is having the kinds of sort of lists of criteria to use as church councils in particular are trying to decide when it might be okay to worship. Do you have any specific thoughts or even perhaps resources you could direct church councils to for this kind of criteria?
Well, let me say this with a supportive smile on my face. It's always a good day to worship. And you don't have to do it with everybody else, just worship, okay? That's important. So I know we'd all agree on that. I guess one of the things I want to leave you with is the fact that anybody who has all the answers to what's happening right now probably also has a bridge to sell you, so be careful. And I think, if nothing else, I've tried today to share with you what I know and don't know. And I think that probably the value that I find most important right now in what I do is humility. Because, I can't go to a church council and say, if you do it this way or that way, it's perfect, it's not perfect. I can cut it at 7.9 inches, but not 7.10 inches, okay? Right. That kind of precision, that kind of issue, we don't know what's going to happen. I mean, I for one have said already, I think we've got a number of states in this country where vaccination levels, particularly in those in groups of individuals who are at highest risk, the communities of color, low SES, older age population individuals who don't have access to much of the health care, If we want to talk about systemic racism right now, look at this disease. It has torn every possible cover off of that oozing wound like I can't believe. And so I think that one of the things we need to do is understand that in the concept of science, social justice, and practical living, there are no magic one answer. And so I wish I could give one to you and say, if you look at this source or that source, our website at SIDRAP is an attempt to give you the best we know. I do that weekly in my podcast. I try to just tell you what we know and what we don't know this week. What are we learning? So I wish I could give you the one magic bullet. I can't. So just think, like fire suits, smoke, cigarette smoke. I'll keep trying to give you the examples that hopefully people can better understand what we're talking about, knowing that there isn't a precision that everyone would like to have.
Yeah. When I was thinking about introducing you today, I thought, and all the preachers in the room should listen carefully for a few metaphors and examples of how to use metaphor effectively in communication, because you do that with such.
Well, as I've said before to you all, everyone has a place of where they learn to test out what tires they have. And I've always said that, I come from a little town of Waukon, Iowa, and the S&D Cafe is on Main Street. It's been there for generations. And there's a 10 o'clock coffee club there. And I figured out a long time ago, if it doesn't sell at the 10 o'clock coffee club at the S&D Cafe and walk on, it ain't going to sell.
Yeah,
so,
that's good.
you got to get that. You got to get that down to understand what the messages are.
Okay, some really quick questions. Are plexiglass screens important when being in person? Like this could have a plexiglass screen right in front of me preaching. It doesn't right now.
Aerosols will go right up and over. Again, think of the cigarettes. If you were sitting there smoking right now, what I smelled on the other side of the plexiglass screen, if I did, you got a challenge. And they do.
Any advice for graduation parties?
Again, it's going to be tough because the kids aren't going to be vaccinated. And if anybody is coming to these parties, because I know kids are going to have them. Kids are going to have them. They just are. I think that the thing I would say is please at least make sure people who are highly vulnerable, who are not vaccinated, not attend. Second of all, if you can do it outside, keep people limited in space and time, that's great. Now, the kids are going to say, well, heck, we're going to school every day. Why can't we have a party? We're together. And, we're seeing happen in schools right now has really been problematic. I don't think a lot of schools will be able to complete the school year in class learning because we have so many right now who are in quarantine, just because of their exposures in school. So I think that my best advice is knowing that these are going to happen. Kids are already getting together in school every day. So how can you say stay away at home but get together in school? How impractical. But please don't expose people who are not vaccinated, particularly those who are more vulnerable. Grandpa and grandma not vaccinated going to a graduation party is an absolute recipe for disaster.
So with humility, one of our listeners suggests this bottom line summation regarding worship. So indoor worship with a mixed congregation, vaccinated and unvaccinated, is risky. Older and middle-aged vaccinated people can still get the virus, and so can children, and children can also give the virus. On the other hand, we're not to restrict worship to the only vaccinated, so indoor worship is probably not recommended for the time being. Outdoor worship is still the recommended model for us. Is that a close to accurate summation?
Yeah, thank you. That's actually very, very good. One summary I would say is if you can assure that your congregation has been vaccinated or previously had infection, go for it. Go for it. I don't care if you put 150 people in there. Now, I know that's wrong relative to the state's requirements. Okay? But again, I'll tell you, and these are my colleagues at the Minnesota Department of Health, who I have the highest respect for. They are the best in the country. Nobody has a magic bullet that says 50. If you go up to 50, you're okay. 51, you're going to sink. That type of thing. And, people are trying to provide practical advice. So I would say at this point, if I would love to be at a Sunday service where everyone in that room was vaccinated, I'd be there with a smile on my face so wide it would go from window to window.
Well, I can't thank you enough for this. And all I would ask is that like 6 months from now, you'll come back and we can have another conversation. It just feels like it is consistently changing and.
It is. I told you, I mean, I mean this seriously. I know less about some of this, like the variant issues right now. You know, this issue about what's going to happen in these locations where they have much lower vaccination rates. I mean, I just remind people, you know, we're not driving this Tiger, we're riding it.
Yeah.
When you think about, just think about what's happened in this country. Last April, we had outbreaks in New York, Boston, Detroit, Chicago, Atlanta, New Orleans, in the Southwest, and California in the North, and the Northwest in Seattle, and then things quieted down. We don't know why. Then Memorial Day, they lit up again in the upper Midwest. Not much, but enough so that we had a peak. Then that went away, and then all of a sudden in early July, the southern states, from Southern California to Georgia, lit up. And then we saw basically 70,000 cases a day reported. Then that went down. And Labor Day, we were right at the area of around 25 to 30,000 cases a day. And then all of a sudden, the Midwest lit up again in October. We got to 200,000 cases a day, with the Dakotas, Iowa, Minnesota, Wisconsin, Michigan, Nebraska accounting for most of the cases. Then that went down. And then we saw in December, from now 135 to 140,000 cases, we went to 300,000 cases in January. And guess what? The same southern states lit up again that had lit up in July. So don't tell me this is about seasonality. Now those cases have come down substantially, but look at Michigan. Look what happened in Michigan. Look what's happened in some of these states. So I don't know what's going to happen even with vaccination. I know vaccination is really important in holding down transmission. But over the next months, we're going to be in an experiment that's playing out into Mother Nature versus us. And, you know, the late Alex Trebek once said, if you can't be impressed by the awe of Mother Nature, then what can you be impressed by? You know, and I think right now, I would like not to be impressed by this virus at all, but I have to be. And so I think that's it. So thank you very much for having me back. I can't wait to be worshiping again with all of you. And again, thank you for what you do for the souls. You know, the souls right now are as every bit as critical as what happens to the bodies. Thank you.
Amen, amen. We thank you so much, and God bless you in your ongoing vocation, serving the healing and wholeness of all people. So blessings to you.